nurse and the UAP should provide the best care possible, including turning the client every 2 hours. Answers 200 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 3. One other person may not be enough to turn or move the client adequately without injuring the staff. 4. The client is not responsive enough to assist in movement. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application making nursing decisions, the NCLEX-RN registered blueprint in CLUD's nursing care that is ruled by legal requirements as well as the Joint Commission, Centers for Medicare and Medicaid Services, Centers for Disease Control and Prevention, and Occupational Safety and Health Administration rules and regulations. The nurse must be knowledgeable of these standards. 54.1. The nurse should administer the IVP narcotic pain medication even if the client has shallow breathing, with respirations of 8. A nurse should never administer a medication with the intent of hastening the client's death, but medicating a dying client to achieve a peaceful death is an appropriate intervention. 2. Repositioning the client would not be effective for pain all over. 3. This is cruel to do to a client who is dying and has made himself or herself a DNR. 4. The HCP has all the orders needed in place. There is no reason to notify the HCP. Content: end of life, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, application making nursing decisions. The NCLEX-RN registered addresses questions concerned with the end of life care. This is included in the psychosocial integrity section of the test blueprint. If unsure of the correct option, selecting an intervention addressing an individual is a better choice. 55.1. The client's ability to maneuver a wheelchair indicates that the client has progressed in therapy. 2. This statement indicates the client is in denial about the prognosis of the injury. 3. Eye blinks may be used for communication in a client with a higher level injury. 4. The building of a wheelchair ramp indicates the husband is preparing for the client's return home, not that the client is progressing in therapy. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, evaluation, client needs, physiological integrity, physiological adaptation, cognitive level, analysis making nursing decisions. The NCLEX-RN registered integrates the nursing process through how the client needs categories and subcategories. The nursing process is a scientific, clinical reasoning approach to client care that includes assessment, analysis, planning, implementation, and evaluation. The nurse will be responsible for determining if goals are being met or are not met. 56.1. Meniere's disease, an excessive accumulation of endolymph in the membranous labyrinth, is characterized by episodic vertigo, tinnitus, fluctuating sensorineural hearing loss, and oral fullness. This client does not need to be contacted first. 2. Otitis media with effusion is an inflammation of the middle ear in which a collection of fluid is present in the middle ear space, resulting in a feeling of fullness of the ear and decreased hearing. This is expected, therefore, the nurse does not need to contact this client first. 3. This client needs to be contacted so culture and sensitivity, CNS, can be done and mild analgesics prescribed. The ear canal has to be cleansed and antibiotic ear drops administered to the ear. Otalgia is ear pain. This client should be contacted for treatment. 4. Otosclerosis is an autosomal disease, the fixation of the footplate of the stapes of the oval window, and results in conductive hearing loss. Therefore, this client does not need to be notified. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The test taker must determine which sign/SYMPT OM is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 57.1. Altered nutrition is a physiological problem but is not priority over safety. 2. Altered mobility is a problem experienced by clients diagnosed with Parkinson's disease. It leads to many other concerns, including the risk for falls resulting from the client's shuffling gait. This is the priority problem. Chapter 7 Neurological Management 201.3. Altered elimination is a problem that the client's altered mobility can cause. This is not, however, the priority problem. 4. Altered body image is a psychological problem and is not priority. Content, mental health, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis making nursing decisions. The NCLEX-RN registered integrates the nursing process throughout the client needs categories and subcategories. The nursing process is a scientific, clinical reasoning approach to client care that includes assessment, analysis, planning, implementation, and evaluation. The nurse will be responsible for identifying nursing diagnoses for clients. 58.1. The nurse must irrigate the eyes, not patch the eyes. 2. The client is in distress and the nurse needs to flush the client's eyes, not assess the visual acuity. 3. For chemical injuries, the nurse should begin ocular irrigation with sterile, pH-balanced, physiological solution. 4. The nurse should elevate the head of bed, but it is not the nurse's first intervention. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The nurse should remember that if a client is in distress, and the nurse can do something to relieve the distress, it should be done first, before assessment. The nurse should select an option that directly helps the client's condition. 59.1. The client admitted to a rehabilitation unit is expected to participate in therapy for at least 3 hours each day. The nurse would not question this order. 2. The client admitted to a rehabilitation unit is expected to participate in therapy for at least 3 hours each day. The nurse would not question this order. 3. Clients with neurological deficits may have trouble swallowing. The nurse would not question this order. 4. A client in a rehabilitation unit for a brain injury should not require 4 medications. The nurse should question this order. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. When the STEM asks the nurse to determine which healthcare provider's order to question, the test taker needs to realize this is an accept question. 3 of the options are appropriate for the HCP to prescribe, and 1 is not appropriate for the client's disease process or procedure. 61. A hospice organization is designed for terminally ill clients. The client is not terminally ill. 2. The speech therapist helps clients regain speech and swallowing abilities. This therapy should have been occurring while the client was in the rehab facility. 3. The physical therapist assists the client with gait and muscle strengthening. This therapy should have been occurring while the client was in the rehab facility. 4. The client is being discharged. The nurse should plan for continuity of care by arranging for a home health agency to follow the client at home. Content, management of care, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis making nursing decisions. The test taker must be knowledgeable of the role of all members of the multidisciplinary healthcare team as well as HIPAA rules and regulations. These will be tested on the NCLEX-RN registered exam. 61.1. It will take approximately 6 weeks for the wound to sufficiently heal prior to being fitted for a prosthetic eye. 2. The nurse should ensure the client can insert the conformer in the eye socket, and the client should be able to demonstrate this to the client. The client does not need more teaching. 3 eye drops must be placed in the lower conjunctiva. Therefore, the client does not need more discharge teaching. 4. The client is at risk for infection and should call the HCP if an elevation in temperature occurs. The client does not need more discharge teaching. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, evaluation. Teaching/learning, client needs, physiological integrity, physiological adaptation, cognitive level, analysis making nursing decisions. This question asks the nurse to identify which statement supports the notion that the client needs more. Answers 202. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Teaching, indicating 3 of the statements are appropriate for the disease process or disorder, but 1 is incorrect. This is an except question even though it does not say all the options are correct except. 62.1. The client may be able to maintain the ability to work for several years before needing to apply for disability. The STEM does not suggest the client is disabled. 2. The client is newly diagnosed, nutrition would not be a problem at this time. 3. The client should be referred to a psychological counselor to develop skills for coping with the long-term chronic illness. 4. The chaplain may need to see the client, but the STEM did not indicate the client was having a problem with spiritual distress. Content: management of care, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis making nursing decisions. The test taker must be knowledgeable of the role of all members of the multidisciplinary healthcare team as well as HIPAA rules and regulations. These will be tested on the NCLEX-RN registered exam. 63.1. The LPN can administer medications to clients, therefore, this task is appropriate for the nurse to assign to the LPN. 2. The client experiencing status epilepticus is an unstable client and the nurse should not assign this task to the LPN. 3. The UAP could assist the client to the bathroom. Remember to assign/delegate tasks based on his or her education and job description. 4. The nurse cannot assign assessment to the LPN. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. When the test taker is deciding which option is the most appropriate task to delegate/assign, the test taker should choose the task that allows each staff member to function within his or her full scope of practice. Do not assign a task to a staff member that falls outside the staff member's or volunteer's expertise. Remember, the nurse cannot delegate assessment, teaching, evaluation, or the care of an unstable client to the LPN. 64.1. The client with a closed head injury is at risk for increased intracranial pressure and the osmotic diuretic is a priority medication. 2. The nurse should administer the medications to the client prior to leaving the unit, but the client with a physiological, potentially life-threatening complication is priority. 3. Before administering a narcotic, the nurse must first assess the client to make sure that administering the medication is not going to mask symptoms. 4. This is a routine medication and can be administered 30 minutes before or after the routine scheduled time. This is not a priority medication. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, analysis, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. The test taker should know which medications are priority medications such as those indicated in life-threatening situations. These must be administered first. 65-1. The charge nurse will not always be available to intercede for the new graduate. The charge nurse should wait and see whether the new graduate is capable of handling the situation before intervening. 2. The charge nurse should wait to allow the new graduate to deal with the UAP. 3. The charge nurse should wait to allow the new graduate to deal with the UAP. 4. The charge nurse should wait to allow the new graduate to deal with the UAP. Content, management of care, category of health alteration, neurological, integrated processes, teaching/learning, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management questions on the NCLEX-RN registered. In many instances, there is no test-taking strategy. The nurse must be knowledgeable of management issues. 66-1. Synthroid is a daily medication. 2-MS Contin is a narcotic analgesic in sustained release form. Patients experiencing pain are unlikely to be able to participate fully in the treatment program. The patient should be medicated to ensure the ability to comply with the treatment regimen. Chapter 7 Neurological Management 203-3. The Fleet's enema is utilized daily to assist the patient in regaining control of the bowels. This should be administered sometime during the evening hours, since administering it during the day would interfere with other therapies such as physical or occupational therapy. Most therapy is completed during the daytime hours. 4. Metformin should be administered with meals to prevent nausea and could be the second medication administered. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, analysis, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered blueprint. The test taker must be able to read a medication administration record, MAR, be knowledgeable of medications, and be able to make an appropriate decision as to the nurse's most appropriate intervention. 67. Answer, 2 20 mg tablets and 1 10 mg tablet. 20 plus 20 plus 10 equals 50 mg. The nurse cannot split a 75 mg tablet into 2/3 of a tablet, so the patient must receive multiple tablets. Content, adult health, pharmacology, category of health alteration, neurological, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, application making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered. The nurse must know how to solve math questions. 68-1, 3, and 4 are correct. 1. The UAP can make hourly rounds on the client, taking the client to the bathroom, giving the client a drink of water, checking to make sure the client is not climbing out of bed, etc. 2. This is the responsibility of the registered nurse or the social worker. 3. This client is in rehab and should be stable so that the UAP can set up the tray or feed the patient. 4. The UAP can clamp and unclamp an indwelling catheter in a rehab area. This is a non-invasive skill that can be taught to the UAP. It does not require judgment. 5. This is the responsibility of the registered nurse or the social worker. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered. The nurse must be able to select all the options that answer the question correctly. There are no partially correct answers. 69-1. The left hand is weak and cannot be depended on to hold a cane. 2. The shoulder is not appropriate for a cane. 3. The right hand is the strongest hand and should be the one holding the cane. A right-sided CVA results in damage to the left side of the body. 4. The shoulder is not appropriate for a cane. Content: medical/surgical, category of health alteration, neurological, integrated processes, physiological integrity, physiological adaptation, client needs, safe and effective care environment, safety and infection control, cognitive level, application making nursing decisions. This is an alternate type of question on the NCLEX-RN registered called hotspot, which asks the nurse to identify the area with the computer arrow. 71. The client has a much lower score than 12 on the Glasgow Coma scale. 2. The client has a lower score than 10 on the scale. 3. The client received 2 points for lack of opening of eyes to previous stimuli but opens to pain. The client receives 1 point for lack of sound even with painful stimuli, 5 points for localizing pain, attempts to remove offending stimulus. This is a total of 8 points. 4. The client has a higher score than 6. Content: medical/surgical, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. This is an alternate type of question include DED in the NCLEX-RN registered blueprint. The test taker must be able to read a chart, be able to assess the client, and be able to make an appropriate decision as to the nurse's most appropriate action. Answers 204. Prioritization, delegation, and management of care for the NCLEX-RN registered exam clinical scenario answers and rationales. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1-1. The client with the right-sided CVA has left-sided paralysis, so placing the call light on the left side is inappropriate. The client would not be able to use the call light since the left side is paralyzed. Elizabeth should intervene. 2. The UAP should assist the client with meals since the client is unable to use the right arm. 3. Using a draw sheet is an appropriate way to move the client up in bed. 4. Placing a small pillow under the shoulder will prevent the shoulder from adducting toward the chest and developing a contracture, so this action does not require Elizabeth to intervene. 2-1. The client may need acetaminophen for the pain, but the nurse should first assess the client to determine whether this is a headache or whether the client has an evolving CVA, which would require notifying the healthcare provider. 2. The client may need a CT scan, but that cannot be determined until Elizabeth assesses the client to determine if the headache is indicative of an evolving stroke. 3. Elizabeth must assess the client to obtain data that will be needed when notifying the healthcare provider. Therefore, this is not Elizabeth's first intervention. 4. Elizabeth must first assess the client to determine whether the client's neurological status is deteriorating, which requires notifying the HCP, or, if the headache is expected, then it would require a narcotic analgesic. 3-1. The client may be developing pneumonia and needs to be assessed, but not prior to a client with a Glasgow Coma scale of 6, which is life-threatening. 2. Ascending paralysis is a symptom of Guillain-Barré syndrome, therefore, Courtney would not need to assess this client first. 3. A 15 on the Glasgow Coma scale indicates the client is neurologically intact, and a 6 indicates the client is not neurologically intact, therefore, Courtney should see this client first. 4. Courtney should expect a client diagnosed with a CVA, stroke, to have some sequelae of the problem, including the inability to speak. 4-1. This medication could possibly cause bleeding, therefore, this medication should be questioned by Mr. Leo. 2. An osmotic diuretic is the medication of choice used to treat increased intracranial pressure which can occur with a closed head injury. 3. Any client with a head injury will be on prophylactic anticonvulsants to prevent seizure activity, so Mr. Leo would not question this order. 4. Clients in the ICU are administered proton pump inhibitors to help prevent stress ulcers, therefore, Mr. Leo would not question this order. 5.1. If the client's bladder is full, Jesse needs to insert a urinary catheter, which will relieve the head. The client may be experiencing autonomic dysreflexia, but Jesse will need to palpate the bladder first. 2. The client is in distress, therefore, the nurse should not assess the client first. 3. The client should be put in the Trendelenburg position for hypovolemia, not for autonomic dysreflexia. 4. The nurse should first palpate the client's bladder to determine if the client is experiencing autonomic dysreflexia, which is what Jesse should consider first with the client's signs/symptoms. 6.1. Placing the client on the side to maintain patent airway is Mr. Leo's priority intervention. 2. The rapid response team is called when the client is alive but the nurse thinks the client is a potentially life-threatening situation. This is a possible intervention but it is not priority as Mr. Leo walks in the room. 3. MR. Leo should determine if the client is incontinent of urine or stool and assess the client's seizure for type of activity. Are the client's eyes rolling, or is the client making guttural sounds, but it is not priority over maintaining patent airway. 4. The client should have privacy but it is not priority over maintaining patent airway. 7.1. An adverse occurrence report may need to be completed, but it is not Mr. Leo's first intervention. Chapter 7 Neurological Management 205-2. Mr. Leo's first intervention is to stop the UAP from inserting the oral airway. Once the seizure has started, there should be no attempts to insert anything in the mouth. At times an oral airway could be inserted if the client has an aura and prior to the seizure, but not once the seizure has started. 3. Once a seizure has started, nothing should be inserted in the client's mouth. 4. Mr. Leo should observe the time the seizure started and the seizure activity, but it is not the first intervention. 8.1, 3, 4, and 5 are correct. 1. A lumbar puncture is an invasive procedure, therefore, an informed consent is required. 2. A lumbar puncture does not insert dye into the client. Therefore, this is not an appropriate intervention. 3. The client should be in the side-lying position with the back arched. This position increases the space between the vertebrae, which allows the HCP easier entry into the spinal column. 4. The client is encouraged to relax and breathe normally. The client should feel some pressure in the back but there should be no pain. 5. The nurse should always explain to the client what is happening prior to and during a procedure. 9.1. The client with bacterial meningitis would be expected to have photophobia, so the most experienced nurse would not need to be assigned to this client. 2. The client with an L4-PSI could have spastic muscle spasms and is not a complication. Therefore, a less experienced nurse could care for this client. 3. A less experienced nurse would be assigned the client with Parkinson's disease because these symptoms are expected for this client. 4. The client with ALS has deteriorating respiratory distress, which is expected, but with these 4 clients the most experienced nurse should be assigned to the client who has respiratory distress. Maslow's hierarchy of needs identifies airway as a priority. 10.1. A Glasgow Coma scale of 15 indicates intact neurological status, so an increase from 11 to 14 is good and the nurse would not need to see this client first. 2. These signs/symptoms indicate spinal shock, therefore, this client should be assessed first and appropriate medications administered. 3. This is the sign of a positive Babinski, which is expected in a client with a brainstem herniation, so this client would not need to be assessed first. 4. These are expected signs/symptoms of West Nile virus, therefore, the nurse would not need to assess this client first. Scenario answers 207. Endocrine management 8. Intuition will tell the thinking mind where to look next. John Salk 1. After receiving the shift report, the 7 p.m. to 7 a.m. nurse is reviewing the medication administration record, MAR, of the client diagnosed with type 2 diabetes. Which intervention should the nurse implement? Questions: client's name, height, 70 inches, date, signature / initials, account number, 123,456, weight, 265 pounds, 23012070, day, nurse RN/DN, allergies, NKDA 0701-1500 0730, DNBG 420 units 1130, DNBG 245 4 units 0730, DN night nurse RN/NN, medication, regular insulin by bedside, glucose subcu. AC and HS60, notify HCP 150 0 units 151 to 202 units 201 to 254 units 251 to 306 units 301 to 358 units 351 to 410 units greater than 400, notify HCP Humulin N 48 units bid subcu. AC 1501 to 2300 1630, DNBG 398 10 units 1630, DN1. Make sure the client receives a snack at bedtime. 2. Check the client's blood glucose level immediately. 3. Have the unlicensed assistive personnel, UAP, give the client some orange juice. 4. Teach the client about the symptoms of diabetic ketoacidosis, DKA. 2. Which task is most appropriate for the medical nurse to delegate to the unlicensed assistive personnel, UAP? 1. Request the UAP to take the diabetic client's HS snack to the client. 2. Ask the UAP to escort the client on the PCA pump to the bathroom. 3. Tell the UAP to witness the client's advance directive. 4. Ask the UAP to show the client how to take the client's radial pulse. 3. Which task is most appropriate for the charge nurse to assign to the licensed practical nurse, LPN? 1. Tell the LPN to change the client's subclavian dressing. 2. Request the LPN to obtain the client's daily weight. 3. Assign the LPN to care for the client in myxedema coma. 4. Ask the LPN to complete discharge teaching to the client. 4. The new graduate nurse on the endocrine unit is having difficulty completing the workload in a timely manner. Which suggestion could the preceptor make to help the new graduate become more organized? 1. Suggest the new nurse take a break whenever the nurse feels overwhelmed with tasks. 2. Tell the new nurse to start the shift with a work organization sheet for the assigned clients. 3. Instruct the new nurse to take 5 deep breaths at the beginning of the shift, and then begin. 4. Review each day's assignments for the new nurse and organize the work for the new nurse. 5. The rehabilitation nurse is caring for a client diagnosed with type 2 diabetes who is 1 week postoperative for left carotid endarterectomy. The client's 11:30 a.m. bedside glucometer reading is 408 mg/dl. Based on the medication administration record, MAR, which intervention should the nurse implement first? 208 Prioritization, delegation, and management of care for the NCLEX-RN registered exam client's name, height, 69 inches, date, signature / initials, account number, 123,456, weight, 165 pounds, 2301-0700, day, nurse RN/DN, allergies, NKDA 0701-1500 0730, DNBG 142 0 units, medication, regular insulin by bed side, glucose subcu. AC and HS60, notify HCP 150 0 units 151 to 202 units 201 to 254 units 251 to 306 units 301 to 358 units 351 to 410 units greater than 400, notify HCP 1501 to 2301. Notify the healthcare provider. 2. Administer 10 units regular insulin. 3. Notify the laboratory to draw a serum glucose level. 4. Recheck the bedside glucometer reading. 6. The charge nurse on the endocrine surgical unit is making assignments. Which task should be delegated/assigned to the team members? 1. Request the licensed practical nurse, LPN, assess the client who is hypoglycemic. 2. Ask the unlicensed assistive personnel, UAP, to assist feeding the client with an adrenalectomy who has a paralytic ileus. 3. Instruct the UAP to insert a nasogastric, N/G, tube into the client who has had a thyroidectomy. 4. Tell the LPN to perform an in and out catheterization for the client diagnosed with acromegaly. 7. Which task is most appropriate for the nurse to delegate/assign when caring for clients on a surgical unit? 1. Instruct the licensed practical nurse, LPN, to feed the client who is 1 day postoperative unilateral thyroidectomy. 2. Ask another nurse to administer an IVP pain medication to a postoperative client in severe pain. 3. Request the unlicensed assistive personnel, UAP, to check the client whose vital signs are AP 112, RR 26, BP 92/58. 4. Instruct the licensed practical nurse, LPN, to obtain the pre-transfusion assessment on a postoperative client. 8. The client diagnosed with Addison's disease is being prepared for emergency surgery and is asking to complete an advance directive. Which type of advance directive should the nurse recommend the client complete at this time? 1. Power of attorney. 2. Living will. 3. Do not resuscitate, DNR, order. 4. Durable power of attorney for health care. 9. The nurse is caring for clients in the post-anesthesia care unit, PACU. Which client requires immediate intervention by the PACU nurse? 1. The client who had a bilateral adrenalectomy who is exhibiting masseter rigidity. 2. The client who had a subtotal thyroidectomy who has not urinated since surgery. 3. The client who had general anesthesia who is sleepy but arouses easily to verbal stimuli. 4. The client who had a pituitary tumor removed and has hypoactive bowel sounds. 10. The charge nurse on a busy 20-bed endocrinology unit must send 1 staff member to the nursery. Which staff member is most appropriate to send to the nursery? 1. The nurse who has worked on the endocrinology unit for 4 years. 2. The graduate nurse who has been on the endocrinology unit for 6 months. 3. The licensed practical nurse, LPN, who has worked in a newborn nursery at another facility. 4. The unlicensed assistive personnel, UAP, who has 6 small children of her own. 11. The nurse is working in an endocrinology unit. Which client warrants immediate intervention by the nurse? 1. The client with acromegaly who has club-like fingertips and large feet. 2. The client with syndrome of inappropriate antidiuretic hormone who has decreased urine output. 3. The client with Cushing's syndrome who has truncal obesity and thin, fragile skin. 4. The client with pheochromocytoma who has a severe pounding headache and chest pain. Chapter 8 Endocrine Management 209 Questions 12. The night nurse enters the client's room and finds the client crying. The client asks the nurse, "Am I dying? I think something is terribly wrong with me, but no one is telling me." The nurse knows the client has pancreatic cancer and has less than 6 months to live. Which response is an example of the ethical principle of veracity? 1. You are concerned no one is telling you something is wrong. 2. Your diagnosis is pancreatic cancer. 3. If you feel something is wrong you should speak with your doctor in the morning. 4. What makes you think there is something wrong and you are dying? 13. The critical care nurse has just received the AM shift report on a client diagnosed with heart failure and who has pre-existing type 2 diabetes. The client has the following medication administration record, MAR. Which medication should the nurse administer first? 210 Prioritization, delegation, and management of care for the NCLEX-RN registered exam client's name, height, 67 inches, date, signature/initials, account number, 123,456, weight, £148 23012070007000 Day Nurse RN/DN Allergies, Penicillin 0701 to 1500 080007300800 Night Nurse RN/NN Medicati. On metformin, glucophage, 100 mg po bid 70/30 insulin 24 units subcodigoxin 0.125 mg IV PQD Rosfin 100 mg IV PB 1501 to 2300 2001. Administer metformin, glucophage, 100 mg po. 2. Administer digoxin 0.125 mg IVP. 3. Administer Rosfin, ceftriaxone, 100 mg IVPB. 4. Administer 70/30 insulin subcutaneously. 14. Which client should the charge nurse on a medical unit assign to a nurse who is 3 months pregnant? 1. The client who is receiving chemotherapy who is immunosuppressed. 2. The client with postoperative hyperparathyroidism who has shingles, herpes zoster. 3. The client with hyperthyroidism who is receiving radioactive iodine I-131. 4. The client diagnosed with AIDS who has a cytomegalovirus infection. 15. The client with hypothyroidism and a diagnosis of myxedema coma is admitted to the critical care unit. Which assessment data warrants immediate intervention by the nurse? 1. The client's blood glucose level is 74 mg/dl. 2. The client's temperature is 96.2 degrees Fahrenheit, AP, 54, R, 12, and BP, 90/58. 3. The client's ABG values are pH, 7.33, PaO2, 78, PaCO2, 48, HCO3, 25. 4. The client is lethargic and sleeps all the time. 16. The nurse is preparing to administer morning medications. Which medication should the nurse administer first? 1. The levothyroxine, Synthroid, a thyroid hormone, to a client diagnosed with hypothyroidism. 2. The Humulin N insulin, a pancreatic hormone, to a client diagnosed with type 2 diabetes. 3. The prednisone, a glucocorticoid, to a client diagnosed with Addison's disease. 4. The Tiotropium, Spiriva, inhaler, a bronchodilator, to a client diagnosed with chronic asthma. 17. The nurse is working on an endocrinology unit. Which client should the nurse assess first? 1. The client diagnosed with diabetes insipidus who has polyuria and polydipsia. 2. The client who is 1-day postoperative thyroidectomy who has neck edema. 3. The client who has hypoparathyroidism who has painful muscle cramps and irritability. 4. The client diagnosed with Addison's who has weakness, fatigue, and anorexia. 18. The client is admitted to the endocrinology unit newly diagnosed with an acute exacerbation of central diabetes insipidus, DI. Which intervention is the priority nursing intervention? 1. Obtain the client's baseline weight. 2. Administer desmopressin acetate, DAP, intranasally. 3. Administer intravenous hypotonic saline. 4. Monitor the client's intake and output. 19. The unlicensed assistive personnel, UAP, tells the nurse the client who had a thyroidectomy has AT 104 degrees Fahrenheit, P 128, RR 26, B/P 164/88. Which intervention should the nurse implement first? 1. Prepare to administer the beta-adrenergic blocker propranolol, Inderal. 2. Notify the healthcare provider immediately. 3. Assess the client's vital signs and surgical dressing. 4. Administer acetaminophen, Tylenol, Postat. 20. The unlicensed assistive personnel, UAP, tells the nurse that a client is crying and upset because she has been told her husband has just died. Which intervention should the nurse implement? 1. Tell the UAP to go and sit with the client. 2. Make a referral for the chaplain to see the client. 3. Ask the HCP to prescribe a mild sedative. 4. Leave the client alone in the room to grieve. 21 at 1000, the client diagnosed with type 1 diabetes is complaining of being jittery, having a headache, and being dizzy. Which intervention should the nurse implement first? 1. Give the client glucose tablets. 2. Provide the client with the lunch meal. 3. Request the laboratory to draw a serum glucose level. 4. Determine the last time the client received insulin. 22. An elderly client diagnosed with thyroid cancer frequently makes statements that are inappropriate for the situation, and is not oriented to place, time, or date. The HCP has ordered a magnetic resonance imaging, MRI, scan of the client's brain. Which intervention should the nurse implement? 1. Administer a mild sedative to prevent claustrophobia. 2. Order a vest restraint for use by the client during the MRI. 3. Make sure the client does not have a pacemaker. 4. Ask a family member to stay with the client while the test is performed. 23. An elderly female client is admitted from the long-term care facility with hyperglycemic hyperosmolar non-ketotic coma. The client does not have any family or friends present. Which resource, S, should the admission nurse utilize to obtain information about the client? 1. The nurse should wait until a significant other can be contacted. 2. The verbal report from the ambulance workers and stat lab work. 3. The transfer form from the nursing home and old hospital records. 4. The healthcare provider's telephone orders about care needed. Chapter 8 Endocrine Management 211 Questions 24. The nurse administering medications to clients on a medical unit discovers the wrong medication was administered to a client, Mrs. Jones. Mrs. Jones had replied she was Mrs. Smith when the nurse asked her name from the MAR. Which step in medication administration did the nurse violate when administering the medication? 1. Asking the client to repeat her name. 2. Verifying the client's armband with the MAR. 3. Checking the medication against the MAR. 4. Documenting the medication on the MAR. 25. The female client diagnosed with type 2 diabetes has frequent urinary tract infections, UTIs. Which priority intervention should the nurse implement? 1. Encourage the client to empty her bladder regularly and completely. 2. Instruct the client to drink 8 ounces of cranberry or lingonberry juice a day. 3. Explain the importance of taking oral hypoglycemic medications. 4. Discuss the importance of taking all the antibiotics. 26. Which laboratory data should the nurse monitor for the client receiving the intravenous solumidrol? 1. Potassium level. 2. Sodium level. 3. Liver enzymes. 4. Glucose level. 27. The nurse is working in an outpatient clinic triaging phone calls. Which client warrants notifying the healthcare provider? 1. The client with type 2 diabetes receiving hemodialysis who has gained 6 pounds since the last dialysis treatment. 2. The client with type 1 diabetes who has early stage chronic renal disease and reports having to go to the bathroom several times at night. 3. The client with syndrome of inappropriate antidiuretic hormone who is very upset because no one has returned the previous phone call. 4. The client with type 1 diabetes who had a kidney transplant and reports decreased urine output and flu-like symptoms. 28. Which client should the endocrinology nurse assess first after receiving the shift report? 1. The client who is 1 day postoperative transsphenoidal hypophysectomy who has clear drainage from the nose. 2. The client diagnosed with Graves' disease who has exophthalmos and Brut's over the thyroid gland. 3. The client with hyperparathyroidism who is complaining of weakness, loss of appetite, and constipation. 4. The client with Addison's disease who has orthostatic hypotension, nausea, and vomiting. 29. Which client is priority to be assigned to a case manager in the outpatient clinic so that care can be achieved? 1. The client with renal calculi who is 2 weeks post lithotripsy procedure. 2. The client who has type 2 diabetes and coronary artery disease, CAD. 3. The client who is diagnosed with hypothyroidism receiving radiation treatment. 4. The client with Addison's disease who is on corticosteroid therapy. 30. Which client is most appropriate for the parish nurse to care for? 1. The post-gestational diabetic client who had triplets and is a single parent. 2. The Presbyterian client who is confined to the home due to severe arthritis. 3. The obese client with Cushing's syndrome who is requesting help with losing weight. 4. The client with chronic renal disease who is being cared for in the home by the wife. 212. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 31. Which task should the ambulatory care nurse delegate to the unlicensed assistive personnel, UAP? 1. Ask the UAP to remove the trash from the room of the client who received radioactive iodine with hyperthyroidism. 2. Instruct the UAP to escort the client outside who is asking to smoke a cigar. 3. Request the UAP check the surgical dressing on the client with an ileal conduit. 4. Tell the UAP to take the glucometer reading on the client about to go to surgery. 32. The nurse is hanging 1000 ml of 4 fluids to run for 8 hours. The intravenous tubing is a microdrip. At how many GDT/min should the 4 rate be set? 33. The clinic nurse is caring for clients using complementary alternative medicine, CAM. Which is not an example of CAM? 1. The client with hypothyroidism who takes Centella asiatica. 2. The type 2 diabetic client who takes cinnamon daily. 3. The client with coronary artery disease, CAD, who takes a daily baby aspirin. 4. The client who uses acupuncture to help quit smoking cigarettes. 34. Which statement is an example of community-oriented, population-focused nursing? 1. The nurse cares for an elderly client living in the community who has had a kidney transplant. 2. The nurse develops an educational program for the type 2 diabetics in the community. 3. The nurse refers a client with Cushing's syndrome to the registered dietitian. 4. The nurse provides pamphlets to the client with chronic renal disease. 35. Which priority intervention should the nurse implement when teaching the client with type 2 diabetes about glucometer checks? 1. Instruct the client to keep a written record of the glucometer readings. 2. Recommend the client check the glucometer reading in the morning. 3. Have the client demonstrate how to correctly perform the glucometer reading. 4. Tell the client to dispose of the lancets and strips appropriately. 36. Which client would most benefit from acupressure, a traditional Chinese medicine, which is considered complementary alternative medicine, CAM? 1. The client with thyroid cancer who has chemotherapy-induced nausea. 2. The client with type 2 diabetes diagnosed with chronic renal disease. 3. The postpartum client who is diagnosed with Cushing's syndrome. 4. The client diagnosed with arterial hypertension. 37. The home health director of nurses hears a nurse and the occupational therapist loudly disagreeing about the care of a newly admitted client while they are sitting in an area that is accessible to anyone coming into the office. Which action should the director of nurses implement first? 1. Ask the staff members to move the argument to another room. 2. Request both individuals to come into the director's office. 3. Call the secretary with instructions for the staff to quit arguing. 4. Tell the staff members that arguing is not allowed in the office. 38. Which client should the nurse on the endocrinology unit assess first? 1. The client with hypothyroidism whose vital signs are T94.2, AP48, RR14, B/P90/68. 2. The client with hypoparathyroidism who has a positive Gvostek sign. 3. The client who is 1 day postoperative thyroidectomy who is hoarse. 4. The client with diabetes insipidus who is drinking large amounts of water. Chapter 8 Endocrine Management 213 Questions 39. Which activities are examples of home healthcare nurse responsibilities when caring for clients with endocrine disorders? Select all that apply. 1. Complete nutritional counseling and teaching for a client on a high-fiber diet. 2. Discuss preoperative teaching for the client having a total right hip replacement. 3. Manage oxygen therapy for a client with chronic obstructive pulmonary disease, COPD. 4. Teach the client and family about administration and side effects of medications. 5. Draw blood for studies related to monitoring disease processes and therapy. 40. The unlicensed assistive personnel, UAP, has just taken the blood pressure of a client who had a thyroidectomy. The UAP tells the nurse that the client's hand turned into a claw when the blood pressure was taken. Which intervention should the nurse implement first? 1. Prepare to administer intravenous calcium gluconate. 2. Assess the client for signs/symptoms of hypoparathyroidism. 3. Request the UAP to elevate the client's head of the bed. 4. Notify the client's healthcare provider immediately. 41. The client diagnosed with type 2 diabetes who has chronic renal disease asks the nurse, "How can I qualify for home health care when I go home?" Which statement is the nurse's best response? 1. You must need constant skilled care by the nurse. 2. You must have a family member living with you. 3. You must be homebound to receive home health care. 4. You must be referred by the hospital social worker. 42. The nurse is providing complementary alternative medicine, CAM, by teaching the client with hyperthyroidism to focus attention, increase self-awareness, and increase concentration on an object. Which type of mind-body intervention is the nurse teaching? 1. Meditation. 2. Imagery. 3. Aromatherapy. 4. Acupressure. 43. Which priority intervention should the nurse implement for the client diagnosed with syndrome of inappropriate antidiuretic hormone, SIAD? 1. Maintain the prescribed daily fluid restriction. 2. Position the client's head of bed with no more than 10 degrees of elevation. 3. Turn and reposition the client every 2 hours while on bed rest. 4. Provide frequent oral hygiene every 2 hours for the client. 44. The Home Health, HH, Agency Chief Nursing Officer, CNO, is making assignments for the nurses. Which client should be assigned to the new graduate nurse who just completed orientation? 1. The client diagnosed with Cushing's syndrome who is dyspneic and confused. 2. The client who does not have the money to get prescriptions filled. 3. The client with full thickness burns on the arm who needs a dressing change. 4. The client complaining of pain who is diagnosed with diabetic neuropathy. 45. The nurse on the endocrinology unit is caring for clients, assisted by an unlicensed assistive personnel, UAP. Which task is most appropriate to delegate to the UAP? 1. Feed the client who is 1 day postoperative transsphenoidal hypophysectomy. 2. Obtain a urine specimen for the client diagnosed with diabetes insipidus. 3. Take the vital signs for the client diagnosed with myxedema coma. 4. Assess the pulse oximeter reading of the client with an Addisonian crisis. 214. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 46. The clinical nurse manager on the endocrine unit overhears the staff nurses upset and arguing over how the clients are being assigned by the charge nurse. Which statement indicates a democratic leadership style by the clinical nurse manager? 1. My charge nurse makes the assignments and I support how she does it. 2. As long as there are no complaints from the clients I will not interfere. 3. I appreciate you telling me about the situation and I will handle it. 4. I will schedule a meeting and we will all sit down and discuss the situation. 47. The hospice nurse is writing a care plan for a client diagnosed with type 2 diabetes mellitus who has peripheral neuropathy. Which client problem has priority for the client? 1. Altered glucose metabolism. 2. Anticipatory grieving. 3. Alteration in comfort. 4. Spiritual distress. 48. The unlicensed assistive personnel, UAP, tells the nurse the client with thyroid cancer who is terminally ill is having deep rapid breathing, but then doesn't breathe for about a minute. Which intervention should the nurse implement first? 1. Explain the client is having Cheney-Stokes respirations. 2. Notify the hospital chaplain to come to the client's room. 3. Go to the client's room immediately and assess the client. 4. Contact the client's family that the client's death is near. 49. Which interventions should the nurse implement for the client diagnosed with hyperthyroidism? Select all that apply. 1. Establish a supportive and trusting relationship to help the client cope. 2. Assist with exercises involving large muscle groups. 3. Instruct the unlicensed assistive personnel, UAP, to apply multiple blankets to the bed. 4. Explain that the caregiver should not leave the client alone. 5. Place the client in a cool room away from high traffic areas. 50. Which statement by the client experiencing exophthalmos indicates the client needs more teaching by the endocrinology nurse? 1. I will use artificial tears to moisten my eyes. 2. I need to wear dark glasses to prevent irritation. 3. I should not move my eyes unless absolutely necessary. 4. I should lightly tape my eyes shut when I sleep. 51. Which action by the unlicensed assistive personnel, UAP, warrants intervention by the nurse caring for the client with type 2 diabetes with chronic renal disease who is on hemodialysis? 1. The UAP times the client's activities to help conserve energy. 2. The UAP applies a lubricant to the lips and oral mucous membranes. 3. The UAP ties a sheet around the client sitting in the chair. 4. The UAP uses a fan to facilitate movement of cool air. 52. The nurse supervisor in the home health, HH, office is assigning tasks for the day. Which task is most appropriate for the nurse supervisor to assign the licensed practical nurse, LPN? 1. Tell the LPN to complete the admission assessment for the client with Cushing's disease. 2. Request the LPN to evaluate the client's response to the new pain medication regime. 3. Request the LPN perform the wound care for the client with a stage 4 pressure ulcer. 4. Instruct to the LPN to visit the client with type 2 diabetes who is stable and needs a hospital bed. Chapter 8 Endocrine Management 215 Questions 53. The charge nurse is checking the morning laboratory results for the clients. Which laboratory results require notifying the client's healthcare provider? 1. The client with hypoparathyroidism who has a decreased serum calcium level. 2. The client with Cushing's disease who has a decreased urine cortisol level. 3. The client with diabetes insipidus who has a low urine specific gravity. 4. The client with hyperthyroidism who has an increased TSH level. 54. The nurse on the medical unit is preparing to administer 0900 medications. Which medication should the nurse question administering? 1. The hormone levothyroxine, Synthroid, to the client diagnosed with hypothyroidism. 2. The metformin, glucophage, to the type 2 diabetic who just had a CT scan with di. 3. The Humulin and insulin to the client with type 1 diabetes who is no longer NPO. 4. The steroid prednisone to a client diagnosed with Addison's disease. 55. The nurse and unlicensed assistive personnel, UAP, are caring for clients on an endocrinology unit. Which task should not be delegated to the UAP? 1. Ambulate the client who had a unilateral adrenalectomy. 2. Change the linens on the client with acute thyrotoxicosis who is diaphoretic. 3. Bring ice-cold water to the client diagnosed with diabetes insipidus. 4. Take the vital signs of a client who has just returned from the post-anesthesia care unit, PACU. 56. The unit manager of an endocrinology unit is over budget for the year and must transfer one staff member to another unit. Which option is the best action for the unit manager to take before deciding which staff member to transfer? 1. Assess each staff member's abilities. 2. Choose the last staff member hired. 3. Ask for input from the staff members. 4. Request the transfer documentation form. 57. The clinic nurse is caring for a 10-year-old client diagnosed with diabetes mellitus type 2. Which client problem is priority? 1. Altered nutrition, excessive intake. 2. Risk for low self-esteem. 3. Hypoglycemia. 4. Risk for loss of body part. 58. The overhead page has just announced a code red, actual fire, on a unit 2 floors below the unit where the nurse is working. Which action should the nurse implement first? 1. Turn off the oxygen supply to the rooms. 2. Evacuate the clients to a lower floor. 3. Close all of the doors to the clients' rooms. 4. Make a list of clients to discharge. 59. The nurse is preparing to administer medications for clients on a medical unit. The client diagnosed with hypothyroidism is complaining of being hot all the time, feeling palpitations, and being jittery. Which intervention should the nurse implement first? 1. Check the client's serum thyroid levels. 2. Assess the client for diarrhea. 3. Document the finding in the chart. 4. Hold the client's thyroid medication. 216. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 60. The nurse is administering medications on an endocrinology unit. Which medication should the nurse question administering? 1. The propylthiouracil, PTU, to the client diagnosed with hyperthyroidism. 2. The desmopressin acetate, DAP, to the client diagnosed with diabetes insipidus. 3. The somatropin, genotropin, to the client diagnosed with hypopituitarism. 4. The propranolol, Inderal, to the client diagnosed with hypothyroidism. 61. The hospice nurse caring for a client diagnosed with diabetes mellitus type 2 observes the client eating a bowl of ice cream. Which intervention should the nurse implement first? 1. Allow the client to enjoy the ice cream. 2. Check the client's blood glucose. 3. Remind the client not to eat ice cream. 4. Suggest the client eat low-fat sweets. 62. The nurse is caring for the client who is 1 day postoperative transsphenoidal hypophysectomy. Which action by the unlicensed assistive personnel, UAP, warrants intervention by the nurse? 1. The UAP places the client with the hob 30 degrees elevated. 2. The UAP tells the client not to cough vigorously. 3. The UAP is helping the client splint the incision. 4. The UAP is taking the client's vital signs. 63. The charge nurse of a surgical unit has been notified of an external disaster with multiple casualties. Which client should the charge nurse request to be discharged from the hospital to make room for clients from the disaster? 1. The client scheduled for a bilateral adrenalectomy in the morning whose preoperative teaching has not been started. 2. The client who had a total abdominal hysterectomy 2 days ago and PCA machine has been discontinued. 3. The client who is postoperative bilateral thyroidectomy who has a hemoglobin of 7 mg/dl and a hematocrit of 22.1%. 4. The client with type 2 diabetes who has just had a kidney transplant and is experiencing fever and pain at the surgical site. 64. For which client's laboratory data should the charge nurse notify the HCP? 1. The potassium level of 3.6 milliequivalent/L in a client diagnosed with heart failure who is taking the loop diuretic furosemide, Lasix. 2. The PTT level of 78 in the client diagnosed with pulmonary embolism who is receiving 4 heparin. 3. The blood urea nitrogen, BUN, of 84 mg/dl in a client diagnosed with end-stage renal disease, ESRD, and peripheral edema. 4. The blood glucose level of 543 mg/dl in a client diagnosed with uncontrolled diabetes mellitus type 1. 65. Which nursing intervention is priority for the intensive care nurse to implement when caring for a client diagnosed with diabetic ketoacidosis, DKA? 1. Assess for a fruity breath odor. 2. Check blood glucose levels AC and HS. 3. Monitor the client's pulse oximeter readings. 4. Maintain the regular insulin for rate on an infusion pump. 66. The client diagnosed with diabetes mellitus type 2 has a hemoglobin A1C of 11 mg/dl. Which intervention should the nurse implement first? 1. Check the client's current blood glucose level. 2. Assess the client for neuropathy and retinopathy. 3. Teach the client about the effects of uncontrolled hyperglycemia. 4. Monitor the client's BUN and creatinine levels. Chapter 8 Endocrine Management 217 Question 67. The nurse is working in an outpatient clinic reviewing lab data. Which client should the nurse notify the HCP first? 218 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Patient Name, FG Laboratory Test White Blood Cell Red Blood Cell Hemoglobin Hematocrit Platelet Account Number, 55,689.25 Patient Values 14.3 4.3 13.3 39 6 149 Gender, Male Normal Values 5 to 10, 103, Female 3.8 to 5.1, 106, Male 4.2 to 5.7, 106, Female 11.7 to 16 G/DL Male 13.2 to 17.3 G/DL Female 35%, 47% Male 39%, 50% 150 to 400, 103, Patient Name, JK Laboratory Test White Blood Cell Red Blood Cell Hemoglobin Hematocrit Platelet Account Number, 44,895.78 Patient Values 5.3 3.9 12.0 36.9 150 Gender, Female Normal Values 5 to 10, 103, Female 3.8 to 5.1, 106, Male 4.2, 5.7, 106, Female 11.7 to 16 G/DL Male 13.2 to 17.3 G/DL Female 35%, 47% Male 39%, 50% 150 to 400, 103, Patient Name, LM Laboratory Test Sodium Potassium Glucose Account Number, 687925 Patient Values 144.9 125 Gender, Female Normal Values 135 to 145 milliequivalent/L 3.5 to 5.0 milliequivalent/L 70 to 120 G/DL Patient Name, OR Laboratory Test Sodium Potassium Glucose Account Number, 258954 Patient Values 136 5.198 Gender, Male Normal Values 135 to 145 milliequivalent/L 3.5 to 5.0 milliequivalent/L 70 to 120 G/DL 68. The client diagnosed with type 1 diabetes is receiving regular insulin, a pancreatic hormone, by sliding scale. The client's glucometer reading is 249. The order reads blood glucose level, 150 0 units 151 to 205 units 201 to 258 units 251 to 312 units greater than 301 Contact healthcare provider. How much insulin should the nurse administer to the client? 69 The nurse in the outpatient clinic is working with an unlicensed assistive personnel, UAP. Which tasks are most appropriate for the nurse to delegate to the UAP? Select all that apply. 1. Take the client to the examination room and take the vital signs. 2. Weigh the client and document the weight in the client's chart. 3. Clean the room and set it up for the next client. 4. Discuss the prescriptions prescribed by the healthcare provider. 5. Call the pharmacy to authorize a refill on a client's prescription. 70. The nurse in an outpatient clinic is returning telephone calls. Rank the calls in the order they should be returned, with the highest priority call first. 1. The call from a husband who states his wife started on an antidepressant and now will not wake up. 2. The call from a client who states the medication that was prescribed for her diabetes mellitus type 2 is too expensive. 3. The client with hypothyroidism who is reporting feeling hot, having hand tremors, and having diarrhea. 4. The call from the pharmacist wanting an authorization to change a medication from a trade name to a generic name drug. 5. The call from the client who had a magnetic resonance imaging, MRI, scan 2 days ago and has not received the results. Chapter 8 Endocrine Management 219 Questions 220 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 1. Mr. Larry, a 24-year-old client diagnosed with type 1 diabetes mellitus, called the office nurse, Mr. John, to report nausea and vomiting. Which of the following interventions should Mr. John implement? Select all that apply. 1. Ask Mr. Larry if he has vomited and if so how many times. 2. Determine Mr. Larry's blood glucose level. 3. Find out what medications the client has taken for the nausea. 4. Tell the patient to drink diet sodas to keep from being dehydrated. 5. Make sure the client does not take his insulin. 6. Tell Mr. Larry to monitor his urine ketones. 7. Have Mr. Larry go immediately to the emergency department of his local hospital. 8. Request Mr. Larry to call 911. 9. Have Mr. Larry call the healthcare provider if he is showing ketones in his urine. 10. Discuss trying to intake carbohydrates equal to his usual caloric intake. 2. Mr. Larry does not improve and is seen in the emergency department of a local hospital and is diagnosed with diabetes ketoacidosis, DKA. He is admitted to the intensive care unit. List 5 interventions his nurse, Ms. Leslie, should implement at this time. 3. Mr. Larry recovers from the DKA and is being discharged from the medical unit. His nurse, Mr. Justin, is preparing the discharge information. Which information should Mr. Justin include in the discharge instructions? Endocrine clinical scenario. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. The client received an intermediate-acting insulin at 1630 plus the sliding scale insulin dose to lower the client's blood glucose level. This client should receive a bedtime snack to make sure the client does not experience a hypoglycemic reaction during the night. Intermediate insulin generally peaks 6 to 8 hours after administration, 2230 to 0030 for this client. 2. The nurse should check the client's blood glucose at 2100 hours, not at the current time. 3. Nothing indicates the client needs an intervention for hypoglycemia at this time. 4. The client with type 2 diabetes would experience hyperglycemic hyperosmolar non-ketotic coma, HHNC, syndrome, not DKA. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, application making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered blueprint. The test taker must be able to read a medication administration record, MAR, be knowledgeable of medications, and be able to make a decision as to the nurse's most appropriate intervention. 2.1. The UAP can take food to the client since this is not a medication and the client is stable. 2. The client on a PCA pump is under the influence of narcotic analgesics and should be on bed rest, not ambulated to the bathroom. 3. None of the hospital employees should witness the client's advance directive. 4. The nurse cannot delegate teaching to the UAP. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The nurse should not delegate assessment, teaching, evaluation, medications, or an unstable client to the UAP. 3.1. The LPN can change sterile dressings according to his or her scope of practice. 2. The UAP can obtain the client's weight, therefore, it should not be assigned to the LPN. 3. The client in myxedema coma is not a stable client and should be assigned to the nurse, not the LPN. 4. Teaching should not be assigned to the LPN, only to the nurse. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The RN should not assign assessment, teaching, evaluation, or the care of an unstable client to an LPN. If any task can be assigned to a UAP, then it should not be assigned to an LPN. 4.1. The new graduate cannot take a break whenever he or she becomes overwhelmed because the work may never get done. The new graduate should schedule breaks throughout the shift, not when he or she wants to take them. 2. The preceptor should recommend that the new graduate use some tool to organize the work so important tasks, such as medication administration and taking vital signs, are not missed. 3. Encouraging the new graduate to calm him or herself down, 5 deep breaths, before beginning work is good, but it will not help the new graduate with time management. 4. The new graduate must find the best way to organize him or herself. Doing the organizing for the new graduate will not help him or her. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. There will be management questions on the NCLEX-RN registered. Concepts of management is included under the category safe and effective care environment and the subcategory management of care. 5.1. The HCP should be notified when the glucose level is verified by the laboratory. 2. The sliding scale indicates that a blood glucose level of 351 to 400 mg/dl requires 10 units of answers and rationales. Chapter 8 Endocrine Management 221 Answers 222 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam. Regular insulin. There is no insulin dosage administered for 408 mg/dl. 3. This should be done, but not until the nurse rechecks the blood glucose level at the bedside. 4. The nurse should first recheck the blood glucose level at the bedside prior to taking any further action. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, diagnostic tests, cognitive level, analysis making nursing decisions. The test taker needs to read all of the options carefully before choosing the option that says, notify the HCP. If any of the options will provide information the HCP needs to know in order to make a decision, the test taker should choose that option. Assessment is the first step in the nursing process. 6.1. The LPN is not licensed to assess the client who is hypoglycemic, nor should the nurse assign or delegate an unstable client. This client is unstable and requires the nurse's assessment skills. 2. The client with a paralytic ileus is NPO and should not have any food. 3. The UAP does not have the skill or training to insert a nasogastric tube. 4. The LPN can perform a sterile procedure such as completing an in and out catheterization. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker must not only know which tasks should be delegated or assigned to the UAP and LPN, the nurse must also know which interventions are appropriate for the client's condition. 7.1. This would be an inappropriate assignment because the UAP, not the LPN, could feed this stable client. 2. The nurse could request that another nurse administer pain medication so that the client obtains immediate pain relief. 3. This client's vital signs indicate that the client is unstable, therefore, the nurse should check on this client and not delegate the assessment to a UAP. 4. The client who requires a blood transfusion is unstable. The nurse should complete the pre-transfusion assessment. The RN, not the LPN, assesses. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. A nurse cannot delegate assessment, teach, evaluation, medications, or an unstable client to a UAP. The nurse cannot assign assessment, teaching, evaluation, or an unstable client to an LPN. The nurse can assign a task to another nurse. 8.1. A power of attorney is a legal document authorizing an individual to conduct business for the client. The nurse should not recommend this type of document for a healthcare situation. 2. The living will usually requests the client's refusal of life-sustaining treatment. General anesthesia requires the client to be intubated and placed on a ventilator, therefore, the client's request to deny this type of life-sustaining effort will not be honored in the OR. The nurse should not recommend this type of advance directive. 3. A DNR order must be written in the client's chart by the HCP and may reflect the client's wishes, but it is not an advance directive. 4. This document would be most appropriate for the nurse to recommend because it names an individual to be responsible in the event the client cannot make healthcare decisions for himself or herself. Content, management, category of health alteration, endocrine, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. Questions on advance directives are included in the NCLEX-RN registered. This content is included under the category Safe and Effective Care Environment and the subcategory Management of Care. 9.1. Masseter-rigidity is a sign of malignant hyperthermia, which is a life-threatening complication of surgery. The client will also exhibit tachycardia, a heart rate greater than 150 bpm, hypotension, decreased cardiac output, and oliguria. It is a rare muscle disorder chemically induced by anesthesia. 2. The client was NPO after midnight and during surgery. Therefore, not urinating since surgery does not warrant immediate intervention. 3. The client who received general anesthesia is expected to be sleepy after surgery and easy to Chapter 8 Endocrine Management 223 arouse, therefore, this client does not warrant immediate intervention. 4. As long as the client has bowel sounds after surgery, hypoactive or hyperactive, then this client does not warrant immediate intervention. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, cognitive level, analysis making nursing decisions. When deciding which client to assess first, the test taker should determine either the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected option, the test taker should determine which situation is more life-threatening. 10.1. The nurse who has worked on the unit for 4 years should not be sent because the nurse's expertise is needed on the unit. 2. The graduate nurse, while knowledgeable of the endocrinology unit with 6 months of experience, would not be sent because he or she does not have experience in the maternal-child area. 3. The LPN with maternal-child area experience would be most helpful to the nursery. 4. The charge nurse should not make assignments based on a staff member's personal life. Content, management, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. There will be management questions on the NCLEX-RN registered. Charge nurse responsibilities are included under the category Safe and Effective Care Environment and the subcategory Supervision. 11.1. Acromegaly, an excessive secretion of growth hormone, results in overgrowth of the bones and soft tissues. Clubbed fingertips and large feet are expected, therefore, this client doesn't warrant intervention. 2. The client with SIAD, due to sustained secretion of antidiuretic hormone, ADH, would be expected to have a low urinary output. This client does not warrant intervention by the nurse. 3. The client with Cushing's syndrome would have truncal obesity and thin, fragile skin, therefore, this client does not warrant intervention by the nurse. Cushing's syndrome is caused by excess secretion of glucocorticoids by the adrenal gland. 4. The client diagnosed with pheochromocytoma, a tumor of the adrenal medulla that produces excessive catecholamine, is expected to have a severe pounding headache and chest pain, but of these 4 clients this client is having pain, which is priority. This client warrants intervention by the nurse. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, cognitive level, analysis. Making nursing decisions, the test taker should use some tool as a reference to guide in the decision-making process. In this situation, Maslow's hierarchy of needs should be applied. Pain is priority even if it is expected. 12.1. This statement is a therapeutic response, but it is not telling the client the truth. 2. The ethical principle of veracity is the duty to tell the truth. 3. This statement is passing the buck, which the nurse should not do if at all possible. 4. This is attempting to obtain more information about the situation, but it is not telling the truth. Content, management, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, comprehension. Making nursing decisions, the NCLEX-RN registered blueprint includes nursing CA. Readdressing ethical principles, including autonomy, beneficence, justice, and veracity, to name a few. 13.1. After the AM shift report, the priority medication should be the insulin prior to the breakfast meal, not Lasix. 2. After the AM shift report, the priority medication should be the insulin prior to the breakfast meal, not digoxin. 3. An antibiotic IVPB is a routine, scheduled medication and should have been administered by the night nurse. There's also a 1-hour leeway when administering this medication. The nurse would have to see whether the IVPB apparatus was hanging at the client's bedside or contact the night nurse before administering this medication. 4. Insulin is a medication that must be administered prior to the meal, therefore, this medication is priority. Content, medical/surgical, category of health alteration, endocrine, integrated processes, nursing. Answers 224. Prioritization, delegation, and management of care for the NCLEX-RN registered exam process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies. Cognitive level, synthesis. Making nursing decisions, the test taker should know which medications are priority medications such as life-threatening medications, insulin, and medications that have specific requirements for effectiveness, such as mucosal barrier agents, carafate. These medications should be administered first by the nurse. 14.1. The pregnant nurse can administer antineoplastic medications to clients. The nurse should not be exposed to antineoplastic agents outside of the administration bags and tubing. The pregnant nurse can care for a client who is immunosuppressed. 2. Shingles, herpes zoster, is a painful, blistering skin rash due to the varicella zoster virus, the virus that causes chickenpox. The pregnant nurse should not be assigned this client. 3. The client receiving radioactive iodine should not be around pregnant women or young children, therefore, the nurse who is pregnant should not care for this client. 4. The client has the cytomegalovirus, which crosses the placental barrier. Therefore, a pregnant nurse should not be assigned this client. Any client with a communicable disease that crosses the placental barrier should not be assigned to a nurse who is pregnant. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, supervision, cognitive level, analysis making nursing decisions. There will be management case. Shins on the NCLEX-RN registered. Charge nurse responsibilities are included under the category safe and effective care environment and subcategory supervision. 15.1. This is within the normal range of 70 to 120 mg/dl. Hypoglycemia is expected in a client with myxedema. Therefore, a 74 mg/dl blood glucose level would be expected. 2. The client's metabolism is slowed in myxedema coma, which would result in these vital signs. 3. These ABGs indicate respiratory acidosis, pH 7.35, PaCO2 greater than 45, and hypoxemia, O2 80. Therefore, this client would warrant immediate intervention by the nurse. Untreated respiratory acidosis can result in death if not treated immediately. 4. Lethargy is an expected symptom in a client diagnosed with myxedema, therefore, this would not warrant immediate intervention. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, disease process, cognitive level, analysis making nursing decisions. The nurse must be knowledgeable of expected medical treatment. For the client, this is a knowledge-based question. The nurse must be knowledgeable of normal laboratory values. These values must be memorized and the nurse must be able to determine if the laboratory value is normal for the client's disease process or medications the client is taking. 16.1. Synthroid is a daily medication and can be administered within the 1-hour time frame, 30 minutes before and 30 minutes after the dosing time. 2. Insulin should be administered before a meal for best effects. This medication should be administered first. 3. Prednisone is a routine medication and can be administered within the 1-hour time frame, 30 minutes before and 30 minutes after the dosing time. 4. Spiriva is a routine daily medication and can be administered within the 1-hour time frame, 30 minutes before and 30 minutes after the dosing time. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis making nursing decisions. The test taker should know what medications are priority medications such as life-threatening medications, insulin, and medications with specific requirements for effectiveness, such as mucosal barrier agents, carafate. These medications should be administered first by the nurse. 17.1. The client with diabetes insipidus, a deficiency in the production of the antidiuretic hormone, will have an increase in thirst and urination. The nurse should not assess this client first. 2. The nurse should assess the client with a thyroidectomy for hemorrhaging every 2 hours. Neck edema, irregular breathing, and frequent swelling are signs of hemorrhaging, therefore, the nurse should assess this client first. Chapter 8 Endocrine Management 225.3. The client with hypofunction of the parathyroid gland is expected to have muscle cramps and irritability. Therefore, the nurse should not assess this client first. Bleeding and loss of airway are priority over an expected symptom of the disease process, which is not as immediately life-threatening. 4. Addison's disease, hypofunction of the adrenal gland, causes the client weakness, fatigue, and anorexia. These signs/symptoms are expected, therefore, the nurse should not assess this client first. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, safety, cognitive level, synthesis make nursing decisions. The test taker must determine which sign/symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 18.1. The nurse should obtain the client's baseline weight, but it is not the priority intervention over restoring the client's circulatory status. 2-desmopressin acetate, DAP, an analog of the antidiuretic hormone, is the hormone replacement of choice for central DI. It is not the first intervention because restoring circulatory volume is priority. 3. In acute DI, hypotonic saline is administered intravenously and is titrated to replace urinary output. Restoring circulatory volume is the priority intervention. Remember Maslow's hierarchy of needs. Physiological needs are priority. 4. Monitoring the client's intake and output is an appropriate nursing intervention but not priority over restoring circulatory volume. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis. 19. 1. Beta-adrenergic blockers are used to treat relief of thyrotoxicosis, a thyroid storm, but it is not the nurse's first intervention. 2. The nurse should notify the healthcare provider of this rare condition, thyrotoxic crisis, but the nurse should first assess the client prior to calling HCP. 3. Since the UAP gave the nurse this information, the nurse must assess the client prior to taking any further action. 4. The nurse should administer acetaminophen, Tylenol, Postat to help decrease the fever, but the nurse should first assess the client since the UAP gave the nurse the information. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis. Making nursing decisions, anytime a nurse receives information and from another staff member about a client who may be experiencing a complication, the nurse must assess the client. A nurse should not make decisions about the client's needs based on another staff member's information. 21. The UAP cannot sit for an extended period of time with a grieving client. 2. A chaplain is a spiritual advisor who can stay with the client until a family member or the client's personal spiritual advisor can come to the hospital to be with the client. 3. The client should not be sedated. Grieving is a natural process that must be worked through. Sedating the client will delay the grieving process. The nurse should allow the client to ventilate her feelings to foster the grieving process, not numb the client. 4. The client may request to be left alone, but the nurse should refer the client for spiritual support first and not assume the client wants to be left alone. Most clients feel the need for someone's presence. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care. Supervision, cognitive level, cognitive. Making nursing decisions, the test taker must be knowledgeable of the role of all members of the multidisciplinary healthcare team as well as HIPAA rules and regulations. These will be tested on the NCLEX-RN registered exam. 21.1. The client is exhibiting signs of hypoglycemia, therefore, the nurse should treat the client's symptoms with a simple carbohydrate, such as glucose tablets. This is the first intervention. 2. The nurse should provide the client with complex carbohydrates so another episode of hypoglycemia will not occur. 3. The nurse could obtain a glucometer reading at the bedside, but having the laboratory answers 226 prioritization, delegation, and management of care for the NCLEX-RN registered exam draw a serum blood glucose level should not be the nurse's first intervention. 4. The nurse should determine the last time the client received insulin, but it is not the first intervention. Remember, The nurse should not assess if the client is in distress. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. When the question asks which intervention should be implemented first, it means all the options are something a nurse could implement, but only one should be implemented first. The test taker should use the nursing process to determine the appropriate response. If the client is in distress, do not assess. If the client is not in distress, then the nurse should assess. 22.1. The client has not complained of claustrophobia. The client has some type of neurological abnormality. 2. A vest restraint will not keep the client's head still during the MRI. 3. The nurse should make sure that the client does not have any medical device implanted that could react with the magnetic field created by the MRI scanner. An implanted ECG device could prevent the client from having an MRI, depending on the age of the pacemaker and the material with which it was made. 4. Family members are requested to stay outside of the area where the MRI is performed. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, safe and effective management of care. Diagnostic examinations, cognitive level, analysis making nursing decisions. The nurse must be knowledgeable of normal diagnostic tests pre and post procedure. These interventions must be memorized, and the nurse must be able to determine if the client is able to have the diagnostic procedure and post-procedure care to ensure the client is safe. 23.1. The nurse needs as much information as possible in order to provide care for the client. The client may or may not have a significant other to be contacted. This is not the best way to try to get information on the client. 2. The ambulance workers will only be able to give a cursory report based on the limited information that was provided to them. This is not the best place to try to get information on the client. 3. The nursing home should send a transfer form with the client that details current medications and diagnoses as well as hygiene needs. Previous hospital records will include a history and physical examination and a discharge summary. This is the best place to start to glean information regarding the client. 4. The HCP orders may contain a current diagnosis but will not contain any information about the client's medical history. This is not the best place to try to get information on the client. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. Assessment is the first step of the nursing process, and the test taker should use the nursing process or some other systematic process to assist in determining priorities. The nurse should access documentation that has objective data about the client's condition. 24.1. The nurse asked the client her name, and the client replied that she was a different person. 2. The step the nurse did not take was to verify the client's armband against the MAR. Checking the identification band against the MAR would have prevented the error. 3. This is not the step that was overlooked. 4. This is not the step that was missed. Content: medical/surgical, medication, category of health alteration, drug administration, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, comprehension making nursing decisions. The NCLEX-RN registered blueprint includes the category medication administration under physiological integrity, pharmacological and parenteral therapies. This is a knowledge-based question. 25.1. Health promotion activities that help prevent UTIs include emptying the bladder. Bacteria can grow in stagnated urine in the bladder, and emptying the bladder will help prevent this. The client is diagnosed with a UTI and antibiotic therapy is the priority nursing intervention. Two enzymes found in cranberries inhibit attachment of urinary pathogens, especially E. coli. Chapter 8 Endocrine Management 227 to the bladder epithelium. Daily cranberry juice helps prevent UTIs, but the priority nursing intervention is taking antibiotic therapy. 3. Women with diabetes are 2 to 3 times more likely to have bacteria in their bladders than women without diabetes. Taking hypoglycemic medication is important, but when the UTI is diagnosed, antibiotic therapy is priority. 4. Antibiotic therapy is the priority intervention for the client with a diagnosed UTI. None of the health promotion activities will treat the UTI, though they will help prevent further UTIs. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, comprehension. Making nursing decisions, the test taker needs to be aware of adjectives in the stem of the question. The word diagnosed should guide the nurse as to the correct answer. Health promotion activities do not treat infections. Antibiotic therapy treats the infection and is the priority intervention. 26.1. Steroids do not affect the client's potassium level. 2. Glucocorticoids do not affect the client's sodium level. 3. Steroids do not affect the client's liver enzymes. 4. Steroids are excreted as glucocorticoids from the adrenal gland and are responsible for insulin resistance by the cells, which may cause hyperglycemia. Therefore, the nurse should monitor the glucose level. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis. Making nursing decisions, the nurse must be knowledgeable of laboratory values affected by medication. These values must be memorized and the nurse must be able to determine if the laboratory value is normal for the client's disease process or medications the client is taking. 27.1. A 6-pound weight gain between dialysis treatments is expected. Therefore, the nurse would not need to notify the client's HCP. 2. In the early stage of renal insufficiency, polyuria results from the inability of the kidneys to concentrate urine, which most often happens at night, nocturia. The nurse would not notify the client's HCP. 3. The nurse should call this client, but psychosocial problems do not take priority over physiological, potentially life-threatening problems. 4. These are signs of an acute transplant rejection, which is potentially a life-threatening problem. Therefore, the nurse should notify the healthcare provider about this client. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis. Making nursing decisions, the nurse should ask, are the assessment data normal for the disease process? If they are normal for the disease process, then the nurse would not need to intervene. If they are not normal for the disease process, then this warrants intervention by the nurse. 28.1. This client should be seen first because clear nasal drainage could be cerebrospinal fluid, CSF, which is a potentially life-threatening complication from surgery. The nurse needs to determine if the drainage has glucose. If it does, it is CSF and the surgeon needs to be notified. 2. The client with Graves' disease has exophthalmos, protruding eyes, and Brught's, swishing sound, over the thyroid gland, so the nurse would not assess this client first. 3. The client with hyperparathyroidism is expected to have weakness, loss of appetite, and constipation. Therefore, the nurse would not assess this client first. 4. The client with Addison's disease is expected to have orthostatic hypotension, nausea, and vomiting. Therefore, the nurse would not assess this client first. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis. Make nursing decisions. The test taker must determine which sign/symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. Answers 228. Prioritization, delegation, and management of care for the NCLEX-RN registered Exam-9. 1. A case manager is assigned to a client with a chronic illness. Therefore, a client with a renal calculi who had lithotripsy would not be appropriate for a case manager. 2. It would be appropriate to assign this client to a case manager since this client has 2 chronic illnesses, often having multiple hospitalizations and chronic complications and requires long-term health care. 3. Hypothyroidism is not a disease process resulting in multiple hospitalizations or chronic complications. 4. A client with Addison's disease on cortico-steroid therapy would not be a client referred to a case manager. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, evaluation, client needs, safe and effective care environment, management of care. Supervision, cognitive level, synthesis. Making nursing decisions. Diabetes and CAD are well-known chronic disease processes and should make the test taker look at this option as the correct answer. Postoperative clients, for the most part, return to their normal life, which would not require a case manager. 31. This client would benefit from a home health nurse but not a parish nurse. 2. A parish nurse, PN, is a registered nurse with a minimum of 2 years of experience who works in a faith community, addressing health issues of its members as well as those in the broader community or neighborhood. The client is a Presbyterian, so that is the reason the parish nurse should care for this client. 3. This option has no faith base, therefore, the parish nurse should not be assigned this client. 4. The client with chronic renal disease and the caregiver need assistance in the home, but the parish nurse does not need to offer it. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care. Cultural effectiveness, cognitive level, analysis. Making nursing decisions. The nurse must be knowledgeable of the roles and responsibilities of different nurses working in different areas of the hospital and the community. 31.1. The UAP should not remove anything from the room. The nuclear medicine personnel will check the waste from the room for radioactivity prior to the removal, and if radioactive, will arrange for disposal in a way that protects the environment. 2. The UAP is hired to care for clients in the ambulatory care unit, not to take a client out to smoke. Clients in ambulatory care should not be smoking prior to or after surgery or procedure. 3. The UAP cannot assess the client's surgical dressing. 4. The UAP can obtain a glucometer reading on a client who is stable, and clients in the ambulatory care unit are stable. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, delegation, cognitive level, application. Making nursing decisions. The nurse cannot delegate a assessment, teaching, evaluation, medications, or an unstable client to the UAP. 32. Answer: